So what is liposuction? Liposuction is when we use metal cannulas through small incisions to remove fat. So who's a good candidate? That's someone that has some subcutaneous fat. That's fat that's underneath the skin. It doesn't address visceral fat. Visceral fat is fat that's on the inside of your abdomen, near your organs. I can't remove that. That can only be removed through weight loss. So doing that liposuction removes that fat. Now, someone who might not be the best candidate is someone who has some loose skin. If you have a lot of loose skin, liposuction can potentially make that skin worse. So you might be a better candidate for a tummy tuck. So liposuction is good for someone who has a fair amount of fat and the quality of their skin is good. There are risks of liposuction: bleeding, infection, scars, something called seroma. So after your procedure, we make sure that you wear a compression garment, and that keeps all that swelling at bay. Depending on the area that we perform the liposuction on, if we do a small area like the chin, that could be done under maybe local anesthetic in the office. If it's larger areas, that needs to be done under general anesthetic in the operating room. That happens at an accredited surgery center with an anesthesia provider. Depending on how many areas are being done, it can take anywhere from 2 to 4 hours. So after surgery, you can have quite a bit of drainage, and that's normal because during surgery, we add tumescent fluid. That tumescent fluid has numbing medication and also has epinephrine, which helps prevent bleeding during surgery. But through those incisions after surgery, you can have some drainage, and sometimes it can be a little worrisome, but that's completely normal. You just want to make sure you have extra towels and bedding for you available. And typically after 24 to 48 hours, all that drainage stops. I see you back in the office the next day to make sure that everything looks appropriate and that you're healing well. Typically, patients will have some soreness, and sometimes it can feel like you got beat up a little bit, but it's well managed with the pain medication. Most patients return to work in about a week, and typically we say no strenuous exercise or heavy lifting for about 6 weeks after your procedure. We do want to make sure that you're wearing your compression garment night and day for those first 6 weeks. And that really keeps the swelling at bay and helps you to heal as well as possible. We often also recommend lymphatic massages. Again, that is where a trained professional helps to massage out some of that lymph fluid, which can cause swelling and discomfort. So liposuction is an awesome procedure. It really helps to contour certain areas of the body in the appropriate candidate. We look forward to seeing you at your consultation. If you have questions, write them down. We'd be happy to answer them for you.